What's an optimized health plan? Let's tell a story to help you understand. Sometimes health insurance seems painful any way you look at it. You know the drill. Pay a lot now in premiums or pay a lot later in deductibles. Or even worse, both. When tragedy strikes, understandably, the bills aren't your top priority. But when the smoke clears, you're left alone to pick up the financial pieces. Unforeseen costs always crop up, such as when you run to the nearest, but sadly, the wrong hospital when Susie breaks her leg. Now you're responsible to pay a hefty bill. What's the solution? You optimize. With an optimized health plan, you can blend an affordable plan with a supplemental plan to supercharge it, while sometimes putting money back in your pocket. So how do we do it? Let's take a look at the Affordable Care Act, also known as Obamacare. This piece of legislation is over 22,000 pages long. Not even Congress completely understands all the ins and outs. Let's break it down in a way that's easier to understand. We're going to use pictures and figures to explain how it works. Keep in mind that while these figures are an example only, they may change slightly for each individual or family. Let's look at an insurance plan like a ladder. Say the ground is here. This ladder is 10% off the ground. That 10% it takes to reach the ladder is what it costs you before insurance begins to cover health care, also known as a deductible, co-pays, and coinsurance, or your part. 10% isn't a bad jump to reach that 90%, but to have that small jump and all these great benefits, you might be paying around $1,000 to $1,500 a month for your premium depending on the size of your family. Let's add 3 more ladders. As you can see, when the monthly payment for these insurance plans get lower, the jump to the ladder becomes, well, difficult. Let's look at the lowest monthly payment plan, the 60/40. The 60% that the ladder does cover are critical care and accidents. Individually, you could be required to pay over $6,000 out of pocket before the insurance begins to kick in. As a family, you could be required to pay as much as $12,700. How about paying for this most affordable plan, but reap the benefits of the first plan with the best coverages? This is what optimized health plans is all about. With an optimized health plan to cover your weak insurance, you can upgrade this critical services only plan to a cushy platinum plan for only about $50 more a month for an individual and around $150 for an entire family. Let's look at this from the big picture. That's either $50 a month here on the optimized plan or $350 there for the non-optimized platinum plan for similar coverage. For such a small fee per year on the optimized plan, the savings of optimizing adds up quickly. On top of the savings provided, another benefit is that we pay you directly. An optimized plan is known as a non-coordinated plan, which means we don't cut a check to the hospital or doctor for Susie's broken leg. We make it out directly to you. That means once the deductible is paid on your 60/40 plan and your regular insurance kicks in, you can pocket that extra cash. You'll need it because little Jimmy just started water skiing. Get started with optimized health plans today and have great health coverage while saving money every month. Let's talk to discuss how we can help you save at least 30% per month on your healthcare costs.
Thank you for taking the time to learn more about optimized health plans. It is my pleasure to welcome you to the OHP family. I would like to personally invite you to find out if you qualify to save between 30 and 60% on your health insurance premiums, increase your coverage, and offer more choices by getting back in touch with the OHP agent that introduced you to this information. You can also connect with us directly through our website at optimizedhealthplans.com or by calling us directly at 844-DIAL-OHP. We look forward to hearing from you.